What are the common denominators getting through to your physicians? Maybe you're a pediatric group and you get a lot of questions about kids having a UTI. Well, at that point, they've wasted time leaving a message for a callback because a potential UTI with a kiddo needs testing, and you can't accomplish that over the phone to the on-call provider. So the patient should really just go to urgent care. Same with strep throat, right? You can't diagnose that over the phone. You got to do a test for it. So add that to your prompting if it's a frequent question you get. Save your providers from getting woken up in the middle of the night with that question, and save that patient time by just telling them what they need to know. Go to urgent care.
I had this issue come up just the other day. I had to call into our pediatric clinic because my daughter had to stay home from a sinus infection, but I looked in her throat and I'm like trying to figure out, hey, I think there's some white spots back there. I need to get her in. And I'm curious if you've ever seen practices maybe even set up something like that. If you're calling about an infection, I don't know, is that something that you've seen, or like in this example you shared, like about UTIs, could that be something that could be set up too?
Yeah, absolutely. I mean, for things that need testing and need really to go into the urgent care, we definitely can add that to the prompting. And I've had groups even make recommendations for an urgent care that maybe they partner with or that's right down the street that they can recommend in the prompting for them to go to.
Well, that's cool. A partnership with like a local urgent care too for the pediatric practice. It's a good idea.
Yeah. So really, it's always just we're trying to empower the caller to make the right decision. And in all of these scenarios, if you're getting several calls for a specific type, again, CCMC with their transportation, that was their number one call type that kept sneaking through to the physician. So it was not mentioned at all in the menu. So patients really didn't know where to go. They were just saying, yeah, I had a question. I need to speak with the provider about it. So adding it to the menu just reduced those down to nothing. So there will be, one-offs that shouldn't be in a prompt. We're not going to be able to accommodate for everything. We don't want the callers sitting on the line listening to a million prompts, but we definitely should tackle the most common if possible. And last one, our biggest recommendation when we talk to groups, we lead with the routine option first. 80% of calls for a typical family practice group are routine. A similar stat for other specialties, but it's specialty dependent. But if that's the most common call, that should be your first option.